Welcome to this Camp for Healthcare presentation, and I'm glad that you are interested to understand how you can effectively communicate to the healthcare audience, the predominant ones being the patients. And I have a small presentation, and then I can also show you how the platform can help. The healthcare companies like hospitals and other providers to communicate to their patients effectively. Today, we are in a world where the health crisis has hit badly, and we all know how much the words, are becoming the most powerful drug used by mankind. In fact, I kind of had a personal experience of going in front of the doctor, for a specific issue which one of my family member was facing, and we were totally worried about, the kind of condition she was in. And when the doctor, went through and just did the checks and gave a specific set of words, that kind of gave a lot of soothing feeling. But not everything which the healthcare companies want to communicate can be communicated on a one-on-one patient like this. Many a times you may need to communicate with the patients and with the family members of the patients on an ongoing basis, and which is manually not pretty much possible. So how can a platform which is meant for communication, which is meant for an automated way of communication, help in this kind of scenarios is what is this presentation all about. So let's get started. Talk about the patient journey and the experience. Right, the patient, comes in various scenarios. Their stages are very different, right? If a new patient comes into contact with the healthcare provider, today you have a problem. A lot of research happens by the patients, and they keep going to different apps and sites which kind of give them a lot of understanding of what a health condition is all about. And on an ongoing basis, these kind of patients has to be patients prospective, who are kind of potential to come and engage with your hospital, can be engaged using multi channel campaigns, right? So to speak, you can engage them, keep providing them information in multiple channels, whether it is through Facebook, through Instagram, through email, or through mobile phones. So there are a variety of channels today through which the patients engage with the healthcare providers. So healthcare providers need to have a facility to engage them on an ongoing basis, and kind of telling them, you are the best destination for them to come and get treated. So that is when they can move from being a patient who's been just doing some research about their health conditions, and they coming and becoming a new patient for your hospital, right? And once they become a new patient, then the care starts, right? So that is where you talk about how well you care for them, right? In terms of whatever you're prescribing them, whatever the kind of treatments you're offering. For example, talk about the physiotherapy kind of sessions you are going to put them through, or the different kind of medication you're putting them through. So there is a lot of communication that keeps happening, a counseling session which you may be scheduling for them. So a different set of communication that needs to keep happening to the patients, right, and to their caretakers who are coming along with them as family members, come together along with the patients to care about them. So a variety of communication can happen through and throughout their journey when they are with you under your care. Thereby, the whole experience of being a patient, right? While the doctors do their bit, while the nurses do their bit, but there is a lot of information gaps that often surfaces, and people need to really arrest those kind of problems. Thereby, the complete patient experience can be delivered. Now, once the care got complete, where the patient gets a discharge and gives you a good feedback about the experience with your hospital, the post healthcare engagement starts, because that is one another scenario where the patients have to be kind of nurtured. They need to be told what to do, what not to do, so that the recovery process becomes a lot more smoother for them, and thereby they are going to be engaged with you on an ongoing basis for any kind of health requirements, you become the preferred destination for them to keep coming back to you. So what does this mean, right? What healthcare communication can do in different kind of scenarios, right? For example, you can do a lot of communication about prevention. That kind of, raises the whole, perception about your organization as a hospital to being a thought leader in your sphere, right? So that you're guiding people of how to prevent health situations, right? So this includes things like raising the awareness of the health risks and your hospital facilities and solutions you provide to them. This kind of also helps them to come for preventive care kind of packages to you, provides them the motivation they need to reduce those risks by engaging in those kind of prevention care, programs, enroll in prevention care programs with your hospital. Post that, once, despite all this prevention efforts, people get into some kind of a health situation, they come to you for care. You can guide the patients and the family to deal with the trauma and the uncertainties. You can kind of give them the heads up, what to expect and what not to expect. Right from simple things like when they can come and visit the patient, simple things like what kind of fee they need to pay for the situation they are going through. In simple things like what are the prescription the doctor has done and when those drugs has to be provided to the patient. The kind of examples we took, like the physiotherapy sessions or the counseling sessions, when they are getting organized, and when you need to bring the patient to that particular session. So there are a variety of communication that can happen during the care and the post-care scenario, where people get a lot of reminders about the next trip to the hospital, how to do the appointment scheduling with the right doctors, guiding them on the do's and don'ts for complete recovery. And all these kind of communication kind of takes the patient experience to a next level altogether. And this is only one audience we talk about for the healthcare providers. Apart from this, there are other, audience like the doctors' communication. You talk about communicating to the community doctors who are actually referring patients to your hospital. So there are a variety of audience you can engage as well. And each one of them kind of brings their own set of things for your hospital. So let's move on to understand certain scenarios so that it becomes a little more clearer in terms of what we are talking about here. So I put a couple of examples. In fact, 3 examples I put in, and which is also configured in the platform so that you will understand how the whole communication will happen in an automated fashion. So talk about the first example, right? This is one of the things which has been a major problem with most of the hospitals, which is about the missed appointments. We serve a dozen hospitals using our CAMP platform, and everywhere this seems to be a problem, right? So, for example, this is one advertisement from a hospital, which kind of talks about, on an average, about 1,000 to 65 patients, outpatient appointments are wasted every week. And this is a lot of money, and there are a lot of drain of the doctor's time. There's a lot of drain on the administrative staff and all that kind of stuff, which kind of amounts to one of the interesting statistics out here is every missed appointment costs about 160 pounds, because you are taking the doctor's time, but you're not showing up. The doctor's time is kind of wasted, and the nurse station and a host of other associated services are also being in the wait stage, which results in about 150 to 160 pounds per appointment being missed. Okay, and you can see some of the interesting statistics here, which talks about by hospital how many appointments got missed by people, and what does it mean, and what kind of areas people are missing the appointments on an ongoing basis. So these kind of things can be avoided if proper communication is being put to place, and we kind of remind them in the rightful manner with the right channels, so that either the missed appointments are kind of reducing, or there is a way they can go ahead and say cancel it, so that you're fully aware at least an hour or two before you end up getting into a surprise scenario, right? So how can camp handle this kind of a scenario? For example, talk about reminding the patients to reduce the missed appointments, right? So this is the fundamental thing a hospital can do, and many hospitals have, or the hospital systems also have the facility to remind the patients to reduce the missed appointments. But reminders alone is not sufficient, right? So beyond reminders, you can also provide a facility to reschedule if they have missed it. Does your communication give them a link for them to go back and reschedule it? If they can reschedule it, can they again, get into the cycle of, again getting into, a scenario where you're talking about how you can, if there is a no response, how can you kind of, wish them get well soon and nurture them so that, they kind of feeling like coming back to your hospital when in need. So how can this kind of a communication can happen? Let's look at that in the, in the system. All right. So here I have got some, this is a platform which we call it as Camp. You might have seen this platform, which kind of helps people to communicate and automate the communications in a very meaningful fashion. So I have configured, some couple of 2 or 3 different use cases for specific to the hospitals. For example, let's look at this missed appointments reminders. So what does this do? This kind of automates a set of communication for people who have taken appointment with your hospital. For example, I kind of go and pick a list or the segment who has got appointments today. All right. So whoever has fixed an appointment with your hospital, I'm picking that particular list. How this list comes into Camp? Either it gets integrated with your hospital information system, whereby this list is already available, whoever has booked the appointments today, and that gets kind of, transferred into Camp. This is one way of doing it. There are small hospitals who also kind of manually pick it up in an Excel format and import it into Camp. Either way it can work. Either you can automate it if the volumes are very high, or you can also do it manually, right? Both ways, it kind of does the same thing. Now, once this list comes into Camp, what Camp can do is what we are going to be looking at. So Camp can, number one, filter out, people who have taken different slots. For example, somebody has taken a 10 a.m. slot, somebody has taken a 11 a.m. slot. How does this happen? Because this is integrated into HIS, and we know what slot they have chosen, and you can also filter them by which hospital in your chain they have booked the appointments. Imagine you have a chain of 5 hospitals or 10 hospitals. You can also kind of group everything into one go so that the complete automation takes care of, segregating them by hospital, segregating them by the slots, and communicating the right things. So when I say choose your slot, right, and they have chosen different slots, right, morning 10 to 11 or 11 to 12, afternoon 2 or 3. So different slots, you can automate it, and depending on the slots, you can schedule your communication. So here, for example, I have taken the 10 a.m. slot and 11 a.m. slot. In a real-time scenario, you will have like 5 other slots where, people are going to get communicated. And then it is not just the slot, right? So you may have different slots, you may have different hospitals, you may have different doctors attending to them, right? So it becomes an interesting grid of communication. So it is not just one, type of communication. So if a particular doctor you have taken appointment who is an orthopedic surgeon, then you may give some prerequisite of whatever they need to bring when they come to see the doctor and things like that in an automated fashion. So it kind of helps to reduce the manual work in a big way. Now, if I take a 10 a.m. slot, can I send a SMS reminder to them? Yeah, I can send a SMS reminder, and I can schedule it in a particular time. I can say, hey, remind them by 9 o'clock, since they're 10 o'clock slot, 9 o'clock, at least 1 hour before I want to send out a reminder. And once the reminder has gone, then at the end of the day, wait for one day. At the end of the day, find out whether their appointment has been, they came as per the appointment or they missed the appointment, right? Yes or no. The green means yes and red means no. This again, data comes back from the HIS, and it kind of picks up and sees whether the appointment is being served or missed. If it is served, you can send out a thank you text. If they have, if they're not served, you can ask them to reschedule the appointment. So what I can do, I can send out a form and ask them to reschedule the appointment in a dynamic fashion. Now, If they have again rescheduled the appointment, you can send out a confirmation, email. For example, I can send out a communication like this, which is designed in the system. You don't need to wait since you have taken the, appointment, and you can tell them what needs to do and when to show up and what are the prerequisites you need to do or bring while you're coming to see the doctor, right? So all this can be automated in a very interesting fashion. And all, since this is an automated campaign, all that your HIS system need to do is just to supply the appointment details of the day and supply whether the appointment has been served or not served, or is it been missed, right? These are the only two pieces of information that needs to come from the HIS. Rest of the things CAMP will automate. And this is just a simple automation which I've shown. There are a lot more detailed automation also you can do, which I will show it in the next, use case. So let's go back to the slide. And let's look at some other use cases. For example, this is another use case where this is followed by a hospital which is specializing in pre and postnatal care, right? Especially with the mother care and the child care kind of hospitals. So they run this program called 3 to 3, which is a program which takes care of right from 3 months in the mother's womb all the way to become 3 years old baby, right? So which is a very critical period for both the mother and the children. And the child, and thereby the communication plays a very vital role. For example, talk about different kind of communication, pre-delivery checklist, right? Talk about communication about new mother care. So you are a new mother, what are the things to do, what are the things not to do? You can send out an infographic which makes them easy for them to follow. Maybe they can print it like a poster and put it in front of them at their home so that they can refer to that infographic on an ongoing basis. You can also talk about what are the child vaccination and the reminders towards child vaccination. Many a times, hospital just give a card and ask them to just maintain the child vaccination detail. But more in the digital world, you can also send out the communication in different channels. You can reach them out on their mobile phones. You can reach them out by email. You can reach them out by social media. So there are a variety of ways you can reach them out and keep reminding them so that they are not missing the vaccination and they take the vaccination on time for the children and ensure that the child is safe. You can also kind of send some social related messages like when to start the solid food, right? And what are the kind of solid foods you can offer to the child. And since you already have a medical history of both the mother and the child, you can also even customize what are the kind of right solid foods you can, administer depending on the mother and the child's health conditions. Similarly, you can also send out communications towards the toddlers, as they reach to, 11 months, 12 months, when they become a toddler, what to do and what not to do. This is another interesting campaign you can configure in CAMP and run it across on an automated fashion. And every month, imagine some 20, 30 mothers who are delivering in your, hospital. That means those 20, 30 mother and the children, their children data can be fed into CAMP. And that's it. Every other communication happens on an automated fashion. You don't need to get into a manual intervention mode at all. Then let's look at another example, talk about a health camp campaign. I'm sure you keep doing a lot of health camps on an ongoing basis, isn't it? This is one way to tell the world that what are the different facilities that exist in your hospital, what are the different practices you kind of offer in your hospital. So it kind of makes it easy for the patients to understand the facilities available with you and what kind of treatment they can get it from you. So imagine this is an interesting health camp which was done by a hospital called Fortis in India, and they have scheduled a particular health camp between 10 a.m. to 1 p.m. in a particular place. So now look at what kind of communication you can do here. So you can run campaign communications like sending out an invite for the health camp. What are the benefits of attending the health camp, in an interesting fashion, so that they can understand by showing up to the health camp what are they going to get. Then you can send out reminders to them, and if they have missed the health camp, you can also send out some wellness guides and things like that, so that they understand what you have covered in the health camp. Let's look at how that works. So for this purpose, we have created some interesting things. Like, for example, we created some assets which is about a wellness guide. So let's look at how the wellness guide looks like. The wellness in the guide is looking like this, which kind of talks about a model wellness guide, what to do, what not to do, and all this kind of information, right? Table of contents and what are the different things one can do for a healthy living. We've also created some forms which talks about health booklet download, right? We've also created some landing pages where we say, hey, here is a health camp, come and register for the health camp. For example, let's look at how this looks like. So if I go here and look at I can build these kind of landing pages, which kind of tells them to come and register for the health camp. Fortis Health Camp, which is happening on June 1, where it is happening, what are the topics you're going to be covering during the health camp. All that information is available. You can also take a preview here, how the health camp thing looks like. So somebody can come and put their name, their email ID, and they can also pick the slots, right? Whether it is a morning slot or an afternoon slot, and submit the form. Thereby, they can get registered for the health camp event, right? So now this can be designed, and you can go and change it often. Easily, right? So there is no such things like, for example, I want to go and change this. For example, great doctors going to speak. Okay, so it is like a what you see, what you get editor. You don't need to, worry about going to a programmer to create these kind of stuff. So we've also created some additional communication, like some email communication, right? Hospital health camp invite. You register with us for this, health camp. So how does that look like? So you can see how does that look like, free health camp invite, register now. If somebody clicks on this register now button, they will go to that landing page for registration. So for example, if they come and see, okay, your free health camp invite, awesome, looks like, I say register now, that means it will open the registration page, right? So all of this kind of getting automated in camp. And we can also keep doing the other things, like other emails, like if somebody is registered, I'm going to send out a communication to remind them, right? I can send out a communication or thanking them for registering. Post the event, I can also send out internal reminders for somebody to upload the people who have attended the health camp. For example, there is an internal person with us who is managing this whole health camp event, and we want to send a reminder to him or her, telling them to upload the list of people who have attended the health camp. So all of that is getting automated. For example, here you can see Stark. Hello, Stark. You are the floor person at the health camp event. Please upload the list of patients who attended by filling this form. Right. So at the end of the day, the person can upload the list, and then the communication can continue. So all these things are created. Similarly, we have created some tweet, get well soon tweet, which kind of says, right, you can send a personalized tweet, got well, download the wellness guide, right? So that, you're kind of telling them you care for them, right? After doing all these things, I'm kind of linking all of them into the campaign, which is the health camp campaign. So here you can see health camp campaign. Let's look at how this campaign looks like. So what I'm picking up is a particular patient persona, right? I'm just looking at people who have subscribed to, who are newsletter subscribers to us and who have also visited our previous health camp. So I'm going to only invite them. And then I'm going to send out an invite, right? After 2 days, I'm scheduling this invite. So the invite looks like this. Okay, great. Somebody clicks on register now, can go to the registration page and fill up the form. I can either send it immediately, or I can send it on a relative date, or I can send it maybe send it on Monday, right? Send Monday morning 10 o'clock. Okay, so it makes different variety of configurations you can do. Once you send the invite, and you can see how many of them registered or not registered. Green means yes, red means no. If they have registered, you can send out a thank you communication. You can also add them to the registered list. If they've not registered, you can send out a reminder after 7 days, right? Um, and now that somebody has registered, what you can do, you can segregate them who have registered for the morning session and who have registered for the afternoon session. You can also send out a note. For example, we know that this health clinic is happening on June 1st, right? So that is what our invite said. So when is it happening? It is happening on 1st June 2020. Awesome. So what I'm going to do is by 25th May, I'm going to close out the registration and send out send out the all the registration list to my telecallers, right? I have a small call center where some telecallers are available who can call these patients and remind them and tell them what to expect during the health camp. And they are using the CRM. So I'm actually sending the list to the CRM so that it can be assigned to the right telecallers or the patient care executives who can pick the phone and call these patients and tell them what to expect during the healthcare event, health camp, right? So depending on the morning session or the afternoon session, I can send out SMS reminder. So what I'm doing is I'm using a variety of channel. It could be email communication, it could be a phone-based mobile text communication, or it could be a communication on the social media, right? I'm sending a different variety of communications to them to different channels, which is more appropriate to that particular situation, right? For a invite, email may be an appropriate channel. For a reminder, SMS or a WhatsApp may be a appropriate channel. So depending on the kind of communication you're doing, you pick the appropriate channel and send out the communication. So now I'm actually sending out the communication, and which is a reminder by morning 9 o'clock. And then once they have attended, right? So I'm sending out a communication once the sessions are over at the evening 5 o'clock, all the health camp sessions are over. I'm going to send out a communication to my internal staff, which is here. You can see is an internal staff who or to an agency who is managing this complete camp. I can send out a communication and tell them, hey, upload the list of patients who have shown up during the health camp. And I'm giving them a couple of days for cleaning up that list and uploading it. Once they've uploaded it, I can see whether attended yes or no. So what I've done, I've just put a tag, tag in their record that yes, they have attended. If they have attended, I'm going to send a thank you message. If they've missed, I'm going to send out a wellness guide to them. I'm going to send out an email saying them, hey, you missed it. We missed you during the health camp. Here is a healthy living booklet. Thereby, you're not even even somebody registered and not showed up, you're still giving them something, right? Somebody clicking on this healthy living stuff, they can fill the form, right? They can fill the form, first name, email, and phone, and they can download the wellness guide, so that you are kind of engaging all the stakeholders depending on what they have done. And this is completely automated. Imagine every month you're running a health camp, right, on different subjects. All that you need to do is change the content a little bit, but the entire automation is set, one time effort, and multiple time you can keep using this on an ongoing basis. So that is what we mean by how to engage with your audience in an automated fashion, without you putting a lot of manual effort. And depending on your business, you can come up with your own examples, and you can configure it on the fly. For example, I can configure a campaign on the fly. It is not rocket science. It's very simple. Or you can take the help of some of our marketing experts who can configure that for you in the tool. For example, I can go here, pick a list, right? Or a form. I can pick a form. Say, for example, I want to pick a website form. Somebody who come to my hospital website and fill up a form. So I'm picking up a form, registration form, and that form, whoever has filled, I can say I can put a decision, right? Whether they have visited a page, they've submitted a form, or they have downloaded an asset. Say, for example, you are giving a wellness guide. Somebody downloads it. That means that person is interested to know a little more about that particular area. For example, you have given a wellness guide for senior citizens, right? So anybody who downloads, they are more interested to know about the senior citizen related wellness. Then you can communicate those kind of specific information. Similarly, you can also put conditions, like for example, contact field value is something. If their age is of a particular, if they are of a particular age group, then you're going to send a separate communication, who are in age group between 16 to 30. Or if somebody who's in a age group of 50 and above, you're going to send a different communication. So I can keep adding these kind of filters, and then I can also put in my actions. Right, the actions could be multi-pronged. I can send out, I can put them into a particular campaign, or I can send out a communication, send an email, right? Or I can send out a text message. I can also tweet them, right? All these different communications I can configure on the flow. So there is no restriction that, how you can configure these campaigns, right? So it becomes a very easy way to structure these campaigns depending on your business needs. And it is a one-time effort, right? Once we set up this kind of a platform for you, we can help you to create those kind of campaigns. And once you've created it, you're on your own. You can keep moving forward. So I hope this, this quick session about how to use an automation platform like Camp for your healthcare related needs and engage your audience like patients or doctors in a more effective fashion is of use to you. Let us talk sometime. If you want a custom walkthrough, I can configure some more workflows and clearly explain you how you can make use of it for your hospitals. And with the kind of current workload that is happening across the healthcare system, thanks to the COVID crisis we are going through today, this kind of automation really helps to communicate effectively to the patients, where manually communicating becomes very difficult. You can configure these kind of standard communication and keep engaging with your audience in a effective fashion. Hope this helps. I look forward to talk to you soon. Thank you.